Of weeks we've been doing quite a lot of research into the situation with regard to this hospital, and I submitted a parliamentary question with regard to the number of additional beds that have been added over the last 10 years, and shockingly 8 years pre-COVID, pre the crisis, not one additional permanent bed was added to this hospital behind us. That's despite the fact that we've had an increase in population, an increase in an ageing population, and also the fact that a local, a neighbouring hospital, Roscommon, actually closed during this period. So this is a crisis due to lack of capacity, and therefore I think it's incredibly frustrating when you hear government ministers coming on the airwaves and talking about the capacity that they're building in the system. It's not happening on the ground, and we actually had more hospital beds in 1980 when we had a population of 3.4 million people than we have today with a population of over 5 million people.
Okay. And there's just one other point, Paul, I want to ask you about. It's a plan by you to have a number of further days of action here at your university hospital.
Absolutely. This is a campaign that's growing. Yeah. People are organising. We had a very successful demonstration here today, and we won't stop until we have increased capacity into the front line. So this isn't just simply about throwing money at a broken system. We need to ensure that that money is focused into the front line, and the evidence is very clear that it's not happening due to the fact that we've got no additional beds in that 8-year period, despite the fact that the government have thrown money and additional billions into the system. So this is a campaign that's going to grow. It started here today, and I'm delighted that so many people came out to the demonstration today, and indeed some political reps. I invited all of the political reps in the county. Unfortunately, we had no government TD here today, and very few government councillors too, but I'm delighted that those who did show up are here representing the people of the county, representing the people who can't represent themselves, who are stuck on trolleys, who maybe are unable to get out on the streets, who have been treated horrendously by the system. Like, we know that overcrowding leads to damaged health outcomes for people and loss of life, and that is a fact. In 2021, 105,000 adverse incidents happened within the HSE. They're incidents where people who were damaged, their health was damaged, patients were damaged as a result of incidents, mistakes, etc. And there's no doubt that overcrowding is leading to that figure. So I'm delighted today to stand with the people of Mayo, and I'm asking people to join the campaign that we've started here today.
Well, thanks very much, Paul.
Great unhappiness about what's happening at the hospital. Great unhappiness about the long lines of trolleys in the place, and people are, I suppose, in a sense, Tom, they're losing hope. They're losing hope that this will ever be changed, and I don't know when it will be changed. Remember, you have 4 people who have spent time in the Department of Health, in the Cabinet, the Taoiseach, the previous Taoiseach, Simon Harris, and the present Minister for Health, and none of them appears to have any impact on it. So you'd have to raise questions about, what their commitment is to health. And bear in mind, Fine Gael have been in government for 13 years continuous, and it's now worse than when they started.
Yeah. And Michael, it's over 20 years now since you've been raising issues about the problems here at Mayo University Hospital. Has there been much improvement over that time?
Very little improvement. In fact, at the ED department, that's now busier than ever, and that was because the Fine Gael government at the time decided to close ED in Roscommon and move the people down here, and no additional staff, no additional space, and now you have all of the additional people that have come into our community from overseas, and no additional help for them either. So you have arrived at a situation where it takes days to get a doctor, it takes days to get through A&E into a hospital bed, and there is no doubt people throughout this country have lost their lives because of the time they have spent waiting to receive help that they've paid for all their working lives.
But it isn't just the case now, Michael, that the patients are being left on trolleys. They're now being put on chairs, and it's. I was just talking to a lady here. She was told us 17 hours.
Yes,
sure.
they have ran out of trolleys.
Yes.
There's no doubt about it. They have ran out of trolleys. But you must remember that in parts of the hospital, for example, down in St. John's, which is an extension of Mayo University Hospital, I'm aware of vacant beds. And the reason there's vacant beds is because of the shortage of staff. And I mean, if we have a situation in this country where we don't have staff to look after our sick, then it's time to turn out the lights and go.
The system was designed by government, as was said here. Like we've had the same government here for the last 11 years. Indeed, for the last 100 years, we've had the combination of Fianna Fáil and Fine Gael. And the system has been systematically destroyed. And when I say destroyed, I mean all of the beds that have been taken out. We have a huge increase in population for the last 20 years, but the bed numbers have been taken out. So then there's a big surprise as to why we haven't sufficient beds to be able to treat patients. We have excellent medics in this country around cancer care, around cardiac and many other things, but often you find a situation where the consultant is there and the surgeon is there waiting to do whatever needs to be done, and there isn't a bed to put the patient in. Now that shouldn't be rocket science. You know, in this day and age, in 2023, we need more beds. Obviously we need more staff as well, but what's happening within the system is the staff are absolutely, the frontline staff are at burnout. Even in here, in Mayo University Hospital, particularly in A&E. I mean, my absolute solidarity and my gratitude to the staff who turn up every day and try and deliver a healthcare service here for the people in Mayo. But it's a combination of things, Tom. It's a combination of the lack of social care and what has been done there in terms of home health, in terms of cares, what's been done there, and what's been done in our community and our district hospitals as well, that the step-down beds aren't there. So you find that, and the figures for here as well, that people have to stay much longer in hospital because there isn't the care in the community for them, because that care has been taken out over the years, and there's a huge amount of waste within the system as well, the waste there. So like the government would say, well, we've done millions here, we've done billions there. That is not good enough. There needs to be proper evaluation of the decision making processes, and there needs to be accountability within the system. We also have to look in terms of the training. We will have people now queuing up to do their Leaving Cert this year. Many of them will get the very maximum points, but they won't get places in medicine, they won't get places in dentistry, they won't get places, you know, for GPs in all the areas that we want them to get, because there isn't enough places there. And in fact, even where there is a limited amount of places in university because of the chronic underfunding, and I was making this point in the Dáil the other day, because of the chronic underfunding of the third level system, they bring in international students, extremely wealthy international students, because they can get 55,000 per place from a wealthy international student, and they may only get 15,000 per place for an Irish student, and that has to be looked at as well in terms of joined up thinking what we need to do here.
With my colleague here, Councillor Michael Kincaid, who's co-here of the Castlebar Municipal District. And first of all, I fully support the work that's been carried out here by the staff of Mayo General Hospital, and it's not good enough that people are on trolleys. It needs to be sorted out once and for all. We need to get in behind, we need to get in behind the staff here. They're working under terrible conditions day and night. For people to be sent off to another hospital 50 miles away here from Castlebar, telling people to go to another hospital in Roscommon, it's not on. It needs to be sorted out. Money needs to be injected. The extension to the A&E needs to be sorted out once and for all. And I'm calling our local deputy here, Alan Dillon, and I see Rose Conway Walsh is here today to raise this in the Dáil, our Dáil deputies, and calling on our junior minister, Jared Canary, also to raise this issue as a matter of urgency in the Dáil. It needs to be sorted out, and we need action is what we want, not people talking. There's too much talking going on. Action we want now on the ground.
Do you feel somewhat frustrated at the fact that the person who holds the position of Minister for Health is a member of your party?
Absolutely, yeah, and I accept that, but we're living here in the west of Ireland. We're not going to be treated like second-class citizens, and I'm calling on the the Minister for Health to come down to Castlebar and to visit other hospitals around the country, especially here in the west of Ireland. Come out and we'll bring you into the hospitals and we'll show you exactly what's going on. And it needs to be sorted out. Action is what we want and not talking.
It's not the staff. The staff are under tremendous pressure. The main problem we have here is that everything's been driven into the accident and emergency unit. You can't get a doctor at the weekend. Primary care centre isn't available at the weekend. If you ring Westdock, it's not working. You have to wait 8 hours to get cover, and then of course you're told to bring the child or whoever up to the accident and emergency unit. So we have to deal with this. We have to have a healthcare system that stops putting pressure on the staff of Mayo General Hospital. We need public representatives who call for the unfilled posts to be filled and for the beds to be made available. But we have to take pressure off the nurses and doctors working in this facility here. And I think the local medical profession need to ask themselves the question, how come they're not available at the weekend? How come we're reliant on Westdock that isn't working? Because we cannot have a situation where somebody's languishing on a trolley for 2 days in a bright environment, a noisy environment, on medication possibly. You know, this is only going to lead to major situations and accidents and an unsafe situation for elderly people. So we need to go back again to that point of, you know, where's the cover at the weekend for a child or a sick person in outlying areas in this county, and what can be done about it?
And how do you feel about the new primary care centre in Castlebar here? Is it operating to the level that you had expected?
Well, I wouldn't say so. I don't think it's available at the weekend. I think it should be available later in the evenings, and I think it should be certainly have a weekend facility for people, because that's what it was designed to do. And I think with joined up thinking there, and you know, an emphasis on shift work, that could be available at the weekend. There should be a situation where you should be able to be treated in the primary care centre at the weekend and not brought up here to the accident and emergency unit. And as well as that, for villages like Achill, places like Achill, North Mayo, places where you cannot get a doctor at the weekend, you have to ask yourself the question why. I mean, I remember in Castlebar 20 years ago when I came to this town, you could get a doctor at the weekend. There was a shift situation there where one was covering the other. That's not happening now, and you're told to ring Westdock, and that facility is not working.